This is part 11. So we are here. We are in emotion regulation. What we will have in next two sessions will be about mindfulness. But today is the last session about emotion regulation. And again, we are not doing full dialectical behavior therapy. We are doing dialectical behavior therapy skills. So I'm adding some skills from the dialectical behavior therapy. To do full course or full therapy with dialectical behavior therapy, it is a 9-month work, and you need individual therapy plus some assignment to do at home, and also the group therapy. And if you are interested to learn more about dialectical behavior therapy, you can ask your family doctor to refer you to dialectical behavior therapy through Access Mental Health. So we have 3 exercises today. First one is about problem solving. Actually, there is a therapy called the solution focused therapy, and I had a training in this therapy. Maybe we will learn some skills about like more deeper skills in problem solving. But in this exercise, we're going to focus on the behavior when we are trying to solve problems. So to understand what we are going to do, this is an example for what is happening. So usually there is an event, and then the event causes us to think certain way, and then the thoughts cause certain emotions, and then the emotion cause behaviors. If the event is negative and cause the negative thoughts, it's gonna end up with negative emotions and feeling, and you're gonna end up with like a negative disruptive behavior. And here is an example. This guy, his mother-in-law is visiting them. And then she looks disgusted at their house. And then this guy, the first thought that come to his mind, oh, our house looks bad. It needs painting, and there is lots of weeds, and needs lots of cleaning, and this place is a dump, and you know, why this place looks like this? I'm a loser. I can't fix it. I don't have enough money to fix it. Anyway, these negative thoughts cause negative feelings, so make him feel shame and sadness and maybe anger. So he became defensive, and he started accusing his mother-in-law of not helping them, and she's not caring. And then when she disagree, he just blew up. So this is a negative event causing lots of, you know, negative thoughts and feeling, and they end up with negative behavior. We want to learn when we see a negative behavior, or sorry, when we see a negative event and we feel that we're gonna respond in a negative way, we need to learn how to find alternatives, like alternatives that is more positive. Like in this example, this guy, so let's say his mother-in-law gonna live with them for or stay with them for 2 weeks or 3 weeks, and she always make negative comments about the house. So and 2 weeks she's gonna be leaving, and he doesn't wanna, you know, bring an argument or disagreement. So he can start thinking about brainstorming, bringing ideas how to cope with this situation without causing more problems. So one way of doing it is distract himself, or maybe ask his wife for support, or to talk to her mom, or maybe validate his mother-in-law, and use maybe the sandwich method, you know. So if you want to tell her to stop, or if you want to ask her for her help, or you want to like ask her to change the way she talk or the way she present the problem or whatever, you give something positive, then the thing that you want to bring it to attention, then something positive. So he might say, you know, if she make a comment about the house is not clean, he might say, yeah, I agree with you, this house needs lots of cleaning. Okay, so this is a validation of what she's saying. Then he can put, I would appreciate if you could help us with cleaning the house, or bringing someone to do mow the lawn or do something about the backyard. And then at the end, he ends the discussion with, thank you again for bringing this to my attention or something. So, like validation, and then go to the point. Anyway, so when we have a problem, we need to, instead of going into the negative, try to find some alternatives that might be positive or at least neutral. And then you brainstorm, you find maybe 5 different ideas, then try to choose the best ideas. Okay, in this situation, this guy, he said, okay, you know what, I will distract myself with music when she is staying with us for 2 weeks, and I will ask my wife for support, and I will run things through her, and she may, talk to her mom or something. And then you need the ideas that you agreed to do internally, you need to put it into practice. So we need commitment to the implementation. So how and the where and the when. So for this guy in this situation, he need to decide when he gonna distract himself, and when he gonna ask his wife for support, and set a plan for this to avoid the negative outcome. So the same thing, I want you, this is the exercise we're gonna do. I want you to tell me about a negative event, okay? And tell me what are the thoughts that you got out of this event? And then what are the feeling and what are the behaviors that you did or you were going to do? And then try to find alternatives, like positive alternatives. And do some brainstorming, find 4 or 5 different alternatives to what is, instead of the negatives that you did or you are planning to do. And then choose 1 or 2 to put into practice, and tell me how you're gonna put them into practice. Again, this is like a CBT way of doing stuff. It is also you'll find lots of overlap between DBT and CBT in the way they look at handling emotional dysregulation. So in this exercise, we just want to learn that some event will trigger negative thoughts and it's gonna trigger negative feeling, but it doesn't have to end up with a negative behavior. We can try to figure out some alternatives. I want you, just one event, you tell me. It could be an interaction between you and your partner, you and your employer, you and your co-worker, between you and your kids, any negative event or negative interactions that you want to talk about. Another exercise we're going to learn today is balancing between your thoughts and the feeling. What do you mean balancing? It is this exercise is mainly for people who have black and white thinking. We call it polarization or polarity in thinking. Like people who see the world as just black and white, they don't see the gray area. So, for example, this is a very popular example, like a straight A student. She's very good, she's sharp, and she got a full scholarship at her college, and she's good. But once she got a poor grade in math, okay, and she forgot about all the achievements she achieved in the past, and she started to call herself, I'm a loser, I'm a failure, and she got upset and angry. So you see, like, she couldn't balance between seeing a negative event and the self-criticism, and also the things that she achieved in the past. So we want to learn. So this exercise is just to help us to see the big picture. We don't want to have a tunnel vision and focus on one thing and forget about the other things. I'm not saying that you see the world as just positive. I want you to see both sides and you balance between both sides. This is another example. This guy, Matthew or Matt, he asked his girlfriend to come over at 3 o'clock. We want to spend some time together. But then she told him, I am busy and I can't come at 3 o'clock. Maybe I'm going to come at 7. She's still caring and she want to, invest time with him and she want to spend some time with him. But he didn't see it this way. He just got angry and he was full of feeling of abandonment. So again, this guy, he didn't see that she is putting effort. Yeah, she didn't come at 3, but she's still putting effort to make some time and come to see him or visit him. So this is where is the imbalance happen. Again, this is a very common one too. Jennifer, this is a girl who grew up in a middle class family. Her family was good, like supportive, kind, caring, very good family. But one day her dad punished her for talking back to him. So it was just one day, one incident. Anyway, this girl, when she grew up and anyone asked her about her childhood, she always express or she gives the impression that it was abusive, upbringing, and it was a negative. All her childhood was a negative experience, and it was verbal abuse and neglect. It's just because of an incident that she had, even though the family is supportive, caring, loving. So you see, when people, they see the world is just white, 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 and then one event they make them see the world as black, black, or negative. This is what we want to learn, is to balance, and see evidence for both sides. For example, like you need to see evidence supporting the self-criticism. That's fine. And also you need to see the evidence that you are a good person too. You need to see evidence that some bad things happen, but also good things happen. So you need to be able to see both. And this is paradoxical, and this take time, and this needs lots of effort. Okay, it is easy to be. I always talk about the pendulum. It is easy to stay here and easy to stay here. It's very hard to stay in the middle. It causes lots of tension, and it needs lots of work. It's easy to say, oh, I'm totally conservative or I'm totally supporting liberal, but to be in the middle, it needs, wisdom and work. And the same thing, sometimes you see evidence that people don't care about you. And sometimes also you need to see evidence that people do care about you. Balance between evidence that you don't do anything right, but also you do things right. So there are some weaknesses and some strengths, and you need to be able to see both. This situation is awful, but not as bad as you think. So, and this is our exercise. It's just to try to find the big picture. So you tell me about something that has caused you negative feeling. Tell me what happened, and you see it as 100%, negative. Tell me what is the evidence that this is negative, but try also to what evidence to contradict what you think and what you feel. So, for example, maybe you are working on your recovery, and then you have been super for 2 years, but you just relapse 1 week ago. Okay. You're going to see this as a complete failure. You're going to see this as completely negative, completely black. But actually, if you look at it, you have achieved sobriety for 2 years, and just one slip is fine. And this is one of the symptoms of the disease of addiction, is relapses sometimes happen, or we call it lapses or slips. So tell me about a situation you look at it in a very negative way, but try to find an evidence for that contradict how you feel and how you think at this time, and then try to make accurate and the fair way to think about the situation. Again, I'm not want to say see only negative, and I don't want to see only positive. I want to see both, and try to appreciate and give myself a credit for the positive, and be grateful for positive things in my life, but at the same time see the negative and set a plan for improvement. So again, this exercise, you balance both. The third exercise is easy. This is easy. One, you're just gonna make a list of 4 pleasurable activities that you did last month. Okay. And tell me, what did you do? How did you feel? And what do you think about the whole experience? Again, tell me 4 pleasurable activities that you did this month or last month. What did you do? How did you feel about this, or while practicing or doing this pleasurable activity? And how do you think about the whole experience? So we have 3 exercises. I want you to choose just 2. If you are quick and you want to do the 3 of them, that's fine. I'm gonna give you 5 minutes to think about it. Then Brooklyn will run the discussion.